If you are over 60, ask yourself this. What if the very pill you take every single day to protect your health is, in fact, the one silently eroding your brain while you sleep? Do you believe you are safe simply because you take your medicine exactly as prescribed, at the right time, in the right routine? It is frightening, because many of my patients thought the same, until one morning they woke up and could no longer recognize the familiar face lying beside them. A stroke does not strike like lightning from a clear sky. It comes like a quiet thief, nurtured by the smallest daily habits you never even noticed. Have you ever considered that your very own medicine cabinet, the one you trust so much, might be hiding seeds of danger? I am a neurologist, and I have treated hundreds of patients who fell into this very situation. They all shared one thing in common. They believed that their daily painkillers, aspirin, or dietary supplements were harmless. But the brain never lies. Once you cross the age of 60, your blood vessels become fragile, your heartbeat slows, and just a single small mistake can lead to consequences that last a lifetime. Imagine waking up tomorrow morning suddenly unable to speak, with one side of your body paralyzed. What would you do? Are you truly willing to gamble your future simply because you have not yet learned this truth? In today's video, I will take you through the 7 most dangerous medication habits that older adults often fall into. This is not rumor nor theory. It is the real risk I witness every single week in my patients. And what troubles me most is that many of the viewers sitting in front of the screen right now, possibly you yourself, may be repeating one of these habits today without even realizing it. And if I were to tell you that the very last habit on this list is something you are doing every morning, would you have the patience to stay until the very end?
Dangerous habit number 1: over-the-counter painkillers. Do you remember the last time you felt aching knees or a sore back? Many older adults choose the simplest solution: open the medicine cabinet and swallow an ibuprofen or naproxen. We call these over-the-counter painkillers, and the labels often carry reassuring words like fast-acting or daily use. But let me ask you, if those pills were truly completely safe, why do I see patients admitted to the hospital because of them every single week? What few people realize is that these drugs, NSAIDs, cause blood vessels to constrict, make the body retain water, and raise blood pressure. Do you know what happens to blood vessels that have aged and stiffened with time when suddenly forced to endure high pressure in the early morning hours? They easily rupture or become blocked. And the most frightening part is that the majority of strokes in older adults occur in the morning, precisely when this pressure surge happens without warning. Remember, just because a drug does not require a prescription does not mean it is safe. Each time you casually pop a pill to ease pain, ask yourself, is that moment of comfort worth risking your memory, your voice, and your independence for the rest of your life? And even if you manage to avoid NSAIDs, there is still another pill that many older adults take every day, believing it protects their heart. But would you ever imagine that it could actually open the door to a devastating brain hemorrhage?
Dangerous habit number 2: taking aspirin without a doctor's guidance. Have you ever heard neighbors or friends say, "Just take an aspirin every day. It will protect your heart and prevent stroke"? And have you ever thought that such a small pill could become a lucky charm for old age? But I must ask you honestly, if aspirin were truly so good for everyone, why do the major cardiology associations warn adults over 60 to be extremely cautious with its use? I remember one of my patients, Mrs. Linda, a 66-year-old retired elementary school teacher in Florida. She had no history of heart disease, but on her friend's advice, she faithfully took aspirin every morning to protect her heart. One day, she suffered a brain hemorrhage right in her living room as she was about to FaceTime her granddaughter. Her family was stunned because they had always believed aspirin was cheap and harmless. Do you see the irony when what they thought was a lifesaver turned out to be the culprit? The truth is that aspirin thins the blood. For people who have already suffered a heart attack or stroke, doctors may prescribe it because the benefits outweigh the risks. But for healthy older adults without cardiovascular disease, that very blood-thinning effect becomes a danger. Can you picture the blood vessels in the brain, already fragile with age, like old brittle pipes? And when the blood is thinner than normal, even the smallest leak can lead to bleeding inside the brain, a catastrophe that can steal away speech, mobility, and even life itself. What makes it more dangerous is that many people buy aspirin over the counter without knowing the proper dosage. Some even combine it with fish oil, turmeric, or other blood-thinning drugs, doubling their risk of bleeding. Are you certain you are taking aspirin the right way, or are you unknowingly planting a ticking bomb inside your body? So the real question you need to ask yourself is not, should I take aspirin, but, is my brain truly safe? Because with just one mistake, you could lose everything. And even if you are on the right drug at the right dose, have you ever considered that taking it at the wrong time could still leave your brain defenseless against danger?
Dangerous habit number 3, skipping night medication or taking it at the wrong time. Have you ever forgotten to take your evening medication and then told yourself, it's fine, I'll just make it up in the morning? Or perhaps you thought that taking it a few hours early wouldn't make much of a difference. But do you realize that even the smallest shift in timing can turn your brain into the most vulnerable target during those critical morning hours? Our bodies run on a tightly regulated biological clock. Blood pressure normally rises sharply in the early morning, between 4 a.m. and 10 a.m. For young people, that rise is simply the body's natural preparation to wake up. But for older adults, especially those with high blood pressure or heart disease, this morning surge can deliver a fatal blow. So what happens if the medicine that was supposed to protect your blood vessels is either forgotten altogether or has already lost its effect because you took it at the wrong time? Some people even believe that doubling up on the dose the next morning can make up for what was missed. In reality, doing so only causes blood pressure to drop suddenly, leading to dizziness, fainting, and even further oxygen deprivation in the brain. Do you really want every morning to become a gamble, where just one mistimed pill could decide whether you will still be able to walk? Consistency is everything when it comes to stroke prevention. You must remember that your biological clock never takes a break, so your protection should never be interrupted either. Now imagine this. Even if you take the right medication at the right time and dose, what happens if you unknowingly combine it with seemingly harmless supplements? Do you truly believe your body is safe, or is that the very moment when a silent chemical storm begins brewing in your blood and brain? Dangerous habit number 4, mixing supplements with medication without knowing the risks. Have you ever assumed that natural products like fish oil, ginkgo biloba, or turmeric must be safe simply because they are advertised as herbs or dietary supplements? And have you ever reassured yourself with the thought, they're just supplements, they can't really do any harm? The harsh truth is that your body does not distinguish between pharmaceutical drugs and herbs. Everything you swallow must be processed by your liver, kidneys, blood vessels, and brain. So can you be sure you are not unknowingly creating a chemical storm inside your body every single day? Take fish oil, for example. Did you know that aside from being beneficial for the heart, it also thins the blood? If you're already on blood thinners, adding fish oil each morning is like placing another ticking time bomb in the blood vessels of your brain. And what about turmeric? It can interfere with the liver's ability to process medications, making the drugs you take either too strong or too weak. Are you confident that the supplement you are taking isn't turning a safe treatment plan into a looming disaster?
The most dangerous part is that these reactions often come with no warning signs. You may not experience an immediate headache or dizziness. Sometimes all you feel is mild fatigue or a touch of confusion until one morning, a stroke appears like a thief in the night. So have you ever listed out every single medication and supplement you are taking for your doctor to review? Or do you still believe that a few herbal pills are too trivial to mention?
Dangerous habit number 5. Using sleeping pills that reduce oxygen to the brain. Have you ever lain awake in the middle of the night, tossing and turning, unable to sleep, until you finally reached for a little blue sleeping pill, thinking it was harmless? And did you reassure yourself, "It's just to help me sleep better, what's the harm?" But do you know that many sleeping pills, especially those containing diphenhydramine or antihistamines, not only make you drowsy, but also slow down your breathing? And can you imagine what happens when the brain of someone over 60 has to function with less oxygen throughout the night? The danger here is that you cannot feel it happening. You are asleep, believing you are resting, when in fact your brain is struggling in a state of oxygen starvation. And this damage does not happen in just one night. It silently accumulates day by day until one morning you wake up and are no longer the same person. So do you really want to trade your clarity and independence for a few hours of shallow, artificial sleep? Don't be fooled by the label that says non-habit forming. Non-habit forming does not mean safe. Many studies have shown that frequent use of sleeping pills in older adults increases the risk of memory loss, falls, and cerebrovascular events. There are safer ways to sleep better: lifestyle changes, light exercise, or light therapy. Have you ever tried those solutions before reaching for a sleeping pill? And even if you manage to avoid those seemingly harmless sleeping pills, do you know that just one very small morning habit, specifically forgetting to drink water before taking your medication, can also push you closer to a dangerous stroke?
Dangerous habit number 6, not drinking water before taking medication. Have you ever swallowed your morning pill with just a tiny sip of water, or even without water at all, thinking, "It's fine, the pill will go down anyway"? But do you know that after 7 to 8 hours of sleep, your body is already in a state of dehydration, and this makes your blood thicker and harder to circulate? Have you ever considered that forgetting a single glass of water could leave your brain to bear consequences that last a lifetime? Not only that, but many older adults are taking diuretics to treat high blood pressure or heart failure, which causes the body to lose even more water. If you don't replenish fluids in the morning, can you imagine how hard your heart and brain will have to work? Just one small blood clot formed in that sluggish circulation can become the trigger for a major stroke. Do you want to gamble your sharpness and independence on such a small habit? A full glass of water in the morning not only helps your medicine absorb better, but also acts like liquid insurance for your brain. It reduces the thickness of the blood, keeps circulation smooth, and protects you during the most dangerous hours of the day. So have you ever truly treated a morning glass of water as a non-negotiable part of your medication routine? And even if you drink enough water, can you be certain that taking too many different drugs at once without monitoring their side effects isn't quietly creating a ticking time bomb inside your body? Dangerous habit number 7. Taking too many different medications without monitoring side effects. Have you ever looked at your pill box and seen it filled from morning to night with tablets of every color and size? Do you assume that taking the right prescriptions at the right doses guarantees you absolute safety? But did you know that the more medications and supplements you combine, the higher the risk of an adverse event, especially once you're over 60 and your body no longer clears drugs as efficiently as it used to? The problem is that older adults often take at least 5, sometimes 10 different medications every day. The liver works more slowly, the kidneys clear toxins less effectively, and the brain becomes far more sensitive. Even a small side effect can turn into a major blow.
Have you ever felt dizzy, exhausted, or tremulous and simply blamed it on old age? Have you ever wondered whether those symptoms could actually be warning signs from the very pills you're taking? What is heartbreaking is that most complications related to polypharmacy are preventable, not by taking fewer medicines indiscriminately, but by closely monitoring side effects, noting any unusual changes, and always bringing a complete list of both medications and supplements to every doctor's visit. Do you treat that vigilance as an essential part of protecting your brain? And here is the truth you must engrave in your mind. Stroke doesn't usually come from one single catastrophic mistake, but from the accumulation of many small daily habits. So the question is, will you let these errors pile up in silence, or will you learn how to reverse them and turn every morning into a shield that protects your brain? Start by drinking enough water each morning before taking your medication. A full glass of water not only helps your medicine be absorbed properly, but also acts as liquid insurance for your brain. It thins the blood slightly and reduces the risk of clot formation. Can you remember one simple habit like that to save your brain? Next, keep your medication routine consistent. Use a pill organizer, set alarms, or ask a family member to remind you. Don't underestimate the difference between on time and missed time, because that difference can be the line between a healthy morning and a trip to the hospital. Do you view taking your medicine on schedule as a life-saving responsibility? Also, discuss with your doctor every medication and supplement you're taking. Don't dismiss fish oil, turmeric, or ginkgo as trivial. A single harmful combination can be enough to trigger a major event. Are you willing to write out a complete list and bring it to your next appointment? Remember, never take aspirin or any other medicine on the advice of neighbors or by hearsay. Your brain is not a place to test folk remedies or tips from friends. Do you want your life decided by luck or by proven science? Finally, make listening to your body's signals a priority. Dizziness, fatigue, trembling hands, difficulty speaking. These are not always just old age. They can be warnings. Have you ever thought that a stroke is simply a sudden tragedy, like lightning from a clear sky? The truth is, it is not. A stroke does not happen overnight. It builds up little by little from the small habits you repeat every morning. Taking medicine without water, skipping your evening dose, mixing supplements carelessly, relying on sleeping pills, or taking aspirin without medical advice. Do you see how the very things that seem harmless can quietly work against your brain? And now, I want to hear from you. Among the 7 dangerous habits I have shared, which one do you feel you need to change the most? Are you ready to begin tomorrow morning? Leave a comment below. Type the number 1 if you found this information helpful and will put it into practice, or type the number 0 if you think I need to improve the content. I will read every comment because your feedback is truly important. Don't forget to press like, share this video with your friends or loved ones because you never know. A single small share from you today might save someone's brain and someone's life. And be sure to subscribe and turn on the notification bell so you won't miss essential tips on senior health, stroke prevention, and living a healthier, fuller life in your later years. So tomorrow morning, what will you choose? To repeat the habits that quietly damage your brain, or to begin a new one that protects you? The answer could decide the next 10 years of your life.